Very nice. Hello, Joelle. Welcome. Feel free to grab a table if you like. Okay, so my name is Brittany Cadence. I'm the Communications Manager at Peterborough Public Health, and it's my great pleasure to welcome you all here today for this special occasion as we Medical Officer of Health, Dr. Thomas Piggott. Thank you all for joining us and helping us welcome him here to Peterborough and Peterborough Public Health. As you know, we mentioned last week that he would be in town and promised immediate availability, so that's what we're going to do today. Before we get underway, though, I would like to offer a land acknowledgement. So we respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beau Soleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, so joining us today, we, along with Dr. Piggott, are our Board of Health Chair, Mayor Andy Mitchell, Interim CEO Larry Stinson, and Dr. Rosanna Salvatierra, who will provide some comments as well about the upcoming transition. And after their comments, I'll be happy to moderate some questions from our reporters in the room, and if any show up on the phone, related to the changing of the guard, as it were. So to start us off, it's my pleasure to introduce our Board Chair, Mayor Andy Mitchell. Please come on. Thank you.
Well, good morning, everybody, or I guess it's good afternoon now. Thank you for taking the time to attend today. And I also want to take an opportunity to thank the media for keeping the public informed during COVID-19. That's been very, very helpful for us at Peterborough Public Health. I'm going to say a few introductory comments, and then I'll be turning it over to Dr. Piggott. So as you are all aware, we will be bidding a fond farewell to Rosanna, as she will soon be beginning the next chapter of her life. The plan is for her to depart in mid-September. The 19th will be her last call day. Peterborough Public Health and the community will miss her. However, her impact on this organization and on the Peterborough community will be felt far into the future. Her service has made a fundamental and positive impact on the people of Peterborough region, including the First Nations of Curve Lake and Hiawatha. There are plans being made to formally mark her departure, and details will be provided shortly. As you know, the board has been actively seeking a new MOH for Peterborough Public Health for some months. We have sought out candidates in Ontario and across the country during a very challenging time. I would like to thank the board, and particularly the selection committee, for their work in this regard. Last week, we announced that Dr. Thomas Piggott would assume the position of Medical Officer of Health and CEO for Peterborough Public Health. Dr. Piggott is currently Medical Officer of Health and VP Lead for Population Health and Rural and Remote Health in the Northern Region of Labrador-Grenville Health. He has an extensive background in public health that includes being a field doctor with Médecins Sans Frontières in the Democratic Republic of the Congo, an active researcher and teacher in public health at both McMaster and Memorial Universities focused on guideline development and health equity. In the past, he has served on the board of directors of the Public Health Physicians of Canada and the World Federation of Public Health Association. He currently sits on the board of the Canadian Public Health Association, and he has extensive experience working with Indigenous populations. I am pleased to the community and in a few minutes to provide an opportunity for the media to speak to him. In the interim, Dr. Piggott will be assuming his new responsibilities on December 1st, and in the interim to manage and to manage the interim between Dr. Salvatierra's departure and Dr. Piggott's arrival, the board has taken the following steps. We have appointed Larry Stinson as the interim CEO. We have designated Donna Turpie as the COVID incident commander, and we have identified Dr. Ian Gemmell, former MOH for Kingston, Frontenac, Lennox, and Addington Public Health, to provide medical direction to public health here in Peterborough. Again, I want to thank you for attending, and it gives me great pleasure to introduce Dr. Thomas Piggott to his first public appearance here as our new Medical Officer of Health. Dr. Piggott.
Thank you, Mr. Chair. Thank you, Dr. Salvatierra. Thank you all for welcoming me here to the community. I'm really excited. I'll keep my remarks brief since I'm only just getting here, and I think I have a lot to learn about the community and the organization. But to start, a big thank you to you, Dr. Salvatierra. I don't think I'd be here were it not for you reaching out to me personally in your succession planning for your retirement and the conversation that we had. When I was working in Ontario previously, your reputation, that of your board and the organization are known not just in the region but across the province for leadership in public health. And they certainly are big shoes to fill, and wish you all of the best in retirement. Very excited for the next chapter and very grateful for the opportunity to join the organization and the community. My family is very excited to relocate here to Peterborough. We'll be closer to our own extended families. A beautiful region, lots of exciting opportunities, a region that's growing, and I'm looking forward to growing with the region and in this role here in the coming years. So a big thank you for the opportunity, having the faith in me to be the Medical Officer of Health, and I'm really looking forward to joining the team. It's been a short series of interactions since I've accepted the responsibility so far, but I've been incredibly impressed with everyone on the leadership team, and have great faith in the team that I'll be joining, and really look forward to it. I know it's been a trying, it's been a high stakes time in the context of COVID. The response has put more pressure and more difficulty, no doubt, on staff who have been working tirelessly for the last couple of years through the pandemic. But I'm so impressed by all the hard work of Peterborough Public Health and how well the city and the county have done, both in keeping COVID-19 cases to a minimum, but also in the rollout of the vaccine, which is not done yet. And there's some period of time between now and when I do start in December, and I know that the organization will continue the hard work of increasing vaccinations and coverage that they have been doing to date. And when I do get here, I'm really excited and looking forward to joining and seeing, how I can contribute and how myself, my family can get engaged into the community. So with that, I'll turn it back over to you, Brittany, but looking forward to the discussion today, and happy to answer any questions, as little as I do know to date, but looking forward to learning and starting out very soon. Thank you.
Thank you very much, Dr. Piggott. So wonderful to have you here. Okay, so to help us paint a picture of what the next 3 months might look like, it's my pleasure to introduce Larry Stinson, our interim CEO. Come on up, Larry.
Okay, thank you, Brittany. So to start, I have to say I've had the pleasure of working with Rosanna for the past 13 years. She arrived here as we were bracing ourselves to respond to H1N1 pandemic. And now she's leaving us after spending the last 18 months responding to COVID. So nice bookends to her PPH career. In between, Rosanna has strengthened Peterborough Public Health's efforts to protect and promote the health of the people of our region and to advance the efforts to address health inequities. She's built a strong public health team, one that's ready to tackle whatever the future brings. That's why I can say with confidence that with the support of our Acting Medical Officer of Health, Dr. Ian Gemmell, we're prepared to continue the important work of public health as we await the arrival of our new Medical Officer of Health. Over the past 18 months, staff across our entire organization have taken on whatever role was needed to help us respond to COVID, to implement the next task passed down by the provincial planning tables, or to keep core programs operational with fewer staff. In each and every case, people have demonstrated their versatility and adaptability and dedication to the health of the people of the City and County of Peterborough and Hiawatha First Nation. A few of us will take on some new roles for the next few months with strong teams of competent staff. We will ensure there's no disruption to the quality of programming our community has come to expect. Obviously, a big focus will continue to be COVID. Donna Chirpy will step up as incident commander for our COVID response team, and there's no one better suited for this role. Donna has been the operational chief since the outset and has built a strong team to support the full scope of work, from vaccination to enforcement to case and contact management to liaison and to communications. This same group of competent staff also look forward to working with our new medical officer of health, Dr. Piggott. We're fortunate to have someone with such great experience and qualifications to join Peterborough Public Health at this critical time. If anything, the past year and a half adaptable our organization can be. Peterborough Public Health won't be the same without Rosanna at the helm, but she has built an organization that can sustain our programs and services over the next few months and that will welcome the opportunity to continue to grow under our new leader, Dr. Piggott. Thank you.
Wonderful. Thank you very much, Larry. All right, so now to provide us with some closing thoughts before we get to the question period, I'm pleased to welcome Dr. Salvatierra up to the podium.
Thanks, Brittany. I just want to share how grateful I am to the Board of Health and particularly to our chair, Mayor Andy Mitchell, for their hard work over these past many months to find such a qualified and suitable successor to serve as Peterborough's next medical officer of health. Dr. Piggott is a worthy and energetic candidate. I'm delighted that we were able to entice him to leave his current posting in Labrador to come to Peterborough. I have shared with him that in my opinion, he could not ask for a more supportive and engaged Board of Health, a more experienced and skilled leadership team, and a more dedicated team of public health professionals and community partners. I know you will give him and his family a warm Peterborough welcome when they arrive here later this fall. I'm delighted to be part of today's media briefing, and I won't be hurt in the least if all your questions are directed to Thomas. Thank you.
Thank you very much, Dr. Salvatierra. Okay, so now it's your turn. So I'll invite each of you individually to ask your questions. When we're done, if you would like to do some one-on-one interviews or have a quick photo op, we can do that just at the end of the event over at the other side of the room. Okay? So why don't we start with you, Paul? If you've got some questions for Dr. Piggott, you're going to start us off. Go ahead.
I guess, Dr. Piggott, welcome. I guess, obviously, you know, for the role that you have in Labrador and the role you're coming into here, there's a lot of commonalities. But I guess what I'm trying to get at, are there things you're going to have to adapt to or see yourself having to adapt to in terms of procedures here, that things might be done a little differently than when you are where you are now? And how do you adapt to those? Is that something that will be easy for you or a challenge? Or
We're sorry, Dr. Piggott, could we just get you to stand at the podium when you answer your questions? Is that okay? Or do you want me to kind of move my mic over there? Or?
Yeah, you can move your mic over there if you like. That might be easiest. Thanks.
Sorry to interrupt. Just need to make sure I get the sound.
Oh, that makes sense.
It does.
Thinking
yeah.
the same.
Oh, Jessica, can you stick on the card too? Thank you.
Yeah, sorry.
Yeah, actually, this is working out well.
Somebody has one left if they want.
That's ours.
Okay, all right. No, I meant that one. Sorry.
No, thanks for the question. So fortunately, it's the same virus, and that's the main thing, I think. You know, I've had significant experience. None of us in public health knew this virus 2 years ago, and we've had to learn a lot. And a big part of that is adapting to the science as it's evolved and the processes. So I mean, I think it will just be another phase of adapting. But I've had lots of experience responding to the COVID-19 pandemic in my current setting. We have a very remote rural. That's created a lot of challenges to managing and vaccine deployment, but we've worked hard to do that and succeed. We've had one of the lowest case counts of COVID-19 in the country in Labrador through hard work and through the same kind of hard work that Peterborough Public Health has done here to keep case counts down. There certainly will be a learning curve to procedures and the people. Fortunately, I worked in Ontario in public health prior to and did my training here in Ontario. Prior to that, the setting's not unfamiliar to me. The role of working in a health unit and the need to kind of engage other partners, including local and provincial partners, is not new, but I'll welcome the support of my team as I do adapt.
And if I may just follow up, you obviously knew what the job requirements were, or you wouldn't have applied. But I want to take it a step further. Like, how much does the coordinates come into play in your decision to apply or to come here? Do you know the area well? Was that a factor in applying? And
Well, I think the biggest thing was the organization and the community. It has a strong reputation, and I knew that it would be a really exciting role in public health. Like I mentioned, Dr. Salvatierra, board chair, the organization has a strong reputation for leadership in public health in the province, and in particular in leadership in public health and health equity, making health a bit more fair in the region. The engagement of the two First Nations on the board in the governance was really important to me. In my current role, I work with 4 Indigenous governments in close partnership for public health programming and response. And that sort of a model and leadership was really exciting to me. We also are very happy to be coming closer to family. We have family in driving distance now, and we're really excited to be closer to home, especially with a couple of young children who grandparents are obviously very excited about seeing a bit more.
nice. And I had one more question for Dr. Salvatierra, if I may. The last 18 months have been hard and difficult on everybody, but now you're headed into a welcome retirement phase. Can you just talk about, and I think you have at times over the last 18 months, but just obviously the most challenging time, I'm assuming, for Peterborough Public Health since you've been here. But I want to talk just a little bit about the stress and how you handled that over the last 18 months. Obviously, having a good team made a big difference, but just I couldn't even imagine how difficult that was for you, and I just wanted you to touch on that now that you're going to be alleviated of some of that stress.
Well, as I've used the metaphor, Paul, of a marathon. And I'm not a marathon runner, but I feel I understand what that's all about now in these, looking back at the last 18 months. It has been a long and sustained effort over months, and it's also been one where we are learning every day and having to be very adaptable and ready, willing to change at a moment's notice. I think the last 18 months, and I'm grateful for that. I'm grateful for the team that has shared this time and this effort with me. And by team, I certainly also want to recognize the efforts of the community. I feel very fortunate to have been here in Peterborough in this position at this time. I can't imagine being anywhere else, really. So I leave with a great deal of gratitude. I must say that it does feel good to at least to be leaving at this time and not any sooner. I feel that, with 82% of our population now with their first dose, and I believe 72% with their second dose, many people out there have good good, strong protection against COVID-19, and can look forward to things like the reopening of schools and as much normalcy as can be afforded at this stage in the pandemic. So I feel it's a good time to be leaving, and I really do look forward to spending more time with my family. And I think that, if anything, that's been the way that I have managed the stress, is that having that strong anchor with a loving and supportive family at the end of a long day. And that's made all the difference.
Nice. Thank you, Dr. Salvatore. Thank you, Brittany.
Thank you, Paul. Our friends from your TV, did you have any questions for our speakers today?
No, we will let you move on.
You're
Thank
good?
you.
Okay, great. Taylor, that's from Peterborough this week.
Thanks. Maybe I'll start with Dr. Salvatore so we don't all have to move our microphones back and forth.
Okay.
But how do you feel about the state of Peterborough Public Health as you're leaving? How do you feel about, how you're leaving your house as you pass the keys on to the next person?
Well, I feel very proud, actually, Taylor. I'm proud to see people like Larry Stinson and Donna Chirpy taking on the roles that the board has offered them in recognition of their tremendous leadership and experience here. I'm also grateful to the board for all the work they've done in being able to find someone like Thomas to come in and to serve the community in this important role as medical officer of health. Yeah, I have a lot of pride in the organization and confidence in that that Peterborough Public Health will continue to promote the health and protect the well-being of everyone here in Peterborough.
Aside from spending time with family, did you have any other kind of post-retirement plans? Any organizations that you're planning on volunteering with or anything like that?
I really haven't had much time to think about that yet. I look forward to having more space in my day to be able to reflect on how I want to spend the remaining years I have. But really, given the work of the pandemic and the work of transition, it's really something I need to leave to a later day.
All right, I'll move my questions over to Dr. Piggott. I'm just wondering, how do you feel about kind of taking over in the midst of kind of these, I think the word everyone is using right now is unprecedented times.
Just wait for the microphone. I mean, it's a big responsibility. That much is clear, but I'm excited. I have a lot of energy and am ready to start into this role, to start into working with this excellent team here. The uncertainty of the pandemic has been the norm for the last almost couple of years now, right? And so there's a part of us that I think has embraced that, like Dr. Salvatore was mentioning around the need to be adaptable and flexible and learn as we go. But no, I'm excited. I think it's a good opportunity in time. We are, however long the tail of this pandemic is, we're on it now, and there's certainly lots of work left to do, but I'm looking forward to starting with the organization and being able to start to turn a new page, one that looks back to the previous chapter, this difficult chapter, and learns lessons, institutionalize the capacity that we will have built, because the whole of the public health community started this pandemic with probably not enough resources to be responding to what we have had to come up against. And we have now built that team. And so being able to build and keep that team strong for future pandemics, for all of the other good work that we do in public health, and it's not often we get to talk about that in the pandemic, but supporting children development and early child education, supporting other issues, health promotion, people who have addictions and who are using drugs. There's a tremendous degree of work that public health does, and I think that learning from the pandemic and moving forward stronger than we were before is something I'm really looking forward to. So thanks, Taylor.
Are there any ideas from your previous role that you want to bring into here, or anything new that you'd like to bring to the table once you're enrolled in December?
Well, I think there's a lot of listening and learning that I'll have to do to start. Starting to get to know the organization. I'm really pleased and glad that there's a focus on health equity. I think public health organizations need to have a strong role in helping to make society and to make health outcomes more fair. And Peterborough Public Health's done a great job of that, has a good, strong track record addressing those issues, and that'll be something that I'll look to grow. Partnerships with local community organizations and doing the work of public health, which has tentacles in all sectors and has relationships with the environment and with municipal county planning. All of those other partners are really important. Looking at all of the good work that's been done and continuing to grow that, those will be some of the priorities. But to start, I think I'll have 2 ears and 1 mouth to learn and to better understand the state of things.
I know COVID is kind of the public health elephant in the room, but another epidemic that we're dealing with is the opioid crisis. What are your thoughts on that and for possible solutions? Because I know, Dr. Salvatierra, has track record of decision making in one direction, and I'm just wondering what your thoughts are on that, and if you would take it in a different direction, or what your thoughts are on kind of resolving the deaths from the opioid crisis.
I'm deeply concerned. I think it's one of the biggest public health issues facing this generation. In certain demographics, it's surpassed motor vehicle collisions as the leading cause of death, and it's deeply disconcerting. I think there is lots of work in public health to do. I think we have lots to share when you think of the health of a population, when you think of harm reduction work, when you think of support for people who are using drugs. And that's been a huge priority of mine, working in the Labrador context, where I brought a lens of harm reduction and new programs and approaches in regards to opioid use, but broader drug use, which is something that afflicts the community certainly there. I think that engagement of community partners that are doing this work, the healthcare organizations, hospital, primary care, etc., but also people who are using drugs themselves, and understanding and learning from people on the front lines what services and supports are needed is going to be really critical to being able to continue to address the crisis, as I know the organization's been involved with.
Okay, that's it for me. Thank you so much.
Thanks,
Wonderful.
Taylor.
Thank you very much, Taylor. Jessica?
I'm going to start with Dr. Salvatierra. Do you mind?
Nope, I don't mind being
Thanks,
here.
Brittany.
Thank you.
No, that's fine.
Oh, awesome, thank you.
No, that's fine.
Do you want?
No, it's all right. It should pick it up.
Dr. Salvatierra, you may have said this already, I was kind of running around the room. Correct? Well, what was it? Do you know him? Do you just know of his work history? Do you know him personally? What was it that drew you to him?
He came with good endorsement from colleagues who've had the chance to work with Dr. Piggott while he was a resident and following his residency here in Peterborough. So I reached out based on the recommendations of colleagues, and I'm very glad that he has accepted the position.
Excellent. Sorry, I gotta go over here now. Or you can over? Only 2 questions.
I'll move it over.
Thanks, Brittany.
Okay.
We're going to have to put you on the payroll, right?
Yeah.
We need to get a lazy
It's kind of a feelings question, Dr. Piggott, but you obviously have a reputation that's worth, one of our finest to come here. What do you think that says about your reputation or your skill set?
Well, I hope it's positive things. I think there is going to be lots to learn and lots of challenges in the role, but I'm excited to grow into it and to learn from people in this organization. That certainly was one of the big is joining a team of strong people, not only the leadership team, the board chair, the whole organization, all the frontline staff that have been doing hard work. So I'm very humbled by it and excited for the opportunity
that's fine. It's really hard to do that, but you should, I think you should be, feel very honored.
I am.
Okay, that's it for me. Taylor kind of got to most of my questions about looking ahead past the pandemic. No, that's fine, then I didn't have to ask them, Taylor.
Teamwork.
Okay, great. Joelle.
Hi, I'm Joelle. I work for the Examiner. How old are you?
I plead the fifth. That doesn't apply in Canada. Older than I look?
You have 2 babies, like little children, right?
Yeah,
Congratulations.
thank you.
What a beautiful community to come to. And
I think so.
Yeah. Oh, yeah, it's absolutely fantastic. Good. We are so looking forward to welcoming you. And everybody else asked all the really good questions already. So.
But you're not going to tell us your age? We do like to keep up. We do. We know Dr. Salvatore is 65.
I think if you could deduce that, then I'll keep with the qualitative answer, no number.
Okay.
Good try. Good catch.
We'll find out when you retire.
Yeah, there you go. If you're good investigative journalists, I'm sure there's a way of figuring it out. So.
There you go. All right.
Any other questions, Joelle?
Nope, that's it. Everyone asked some great ones. Thank you.
Okay. All right. Well, I'm going to quickly check in to our guests on the line. Are there any other reporters who joined us today? Okay, then I think we are ready to wrap it up. Thank you to our staff who tuned in today. That brings our media event to a conclusion. Now, if there are desires to have one-on-one interviews with Dr. Piggott, we can do that.
I think we're okay.
You're good?
I'm okay.